on 89.1 Radio for FM, number one for hit Gaane. My name is Sapna. And today we have Dr. Gaurav Prakash with us, who's a cornea, refractive and cataract surgeon. Hi, doctor. How are you doing?
Good, Sapna. How are you doing?
Very good. So, people are curious to know so many things about it. So, first question that I have for you, doctor, is what is keratoconus or conical cornea?
Keratoconus is a disorder in which the front part of the eye, the cornea, which is supposed to be round and spherical, like a ball, it tends to bulge forward. ये जैसे मान लो एक बॉल होता है, राउंड होता है, स्मूथ होता है. कॉर्निया हमारा पुतली जिसको हम हिंदी में बोलते हैं, that is the part. What happens with due course of time is कि जैसे ये वीक होना शुरू हो जाता है, starts to bulge. और जब ये बल्ज होना शुरू होता है तो पेशेंट को दिखना कम हो जाता है. The cylindrical number increases. रात में विजन कम होना शुरू हो जाता है, itching, watering ऐसे symptoms आने शुरू होते हैं. And it is a irreversible change. That means इसको आप अगर टाइम से पिकअप नहीं कर सको तो इसको रिवर्ट नहीं कर सकते हम लोग.
Okay. So how to suspect and check for keratoconus?
See, the most important sign for keratoconus obviously is that you should have an unstable number. Especially क्योंकि ये बीमारी बच्चों में जो कि अर्ली यंग एडल्ट्स हैं या टीनेजर्स हैं उसमें शुरू होती है. It keeps on growing till you are 30-35 years of age. ठीक है. So the earliest sign which happens is that you will have an unstable number. आपका astigmatism जो चश्मे का नंबर होता है वो चेंज होता रहता है बार बार. या फिर पेशेंट को आई रबिंग के सिम्टम्स रहते हैं, बहुत बार आंख रब करने की लगता है कि इच करना पड़ता है बार बार. स्पेशली नाइट की ड्राइविंग जो होती है वो दिन की ड्राइविंग से खराब होती है. दिन में हैलोज ग्लेयर रात में ज्यादा बढ़ जाते हैं पेशेंट को. तो ये नॉन स्पेसिफिक सिम्टम्स होते हैं जिसके कारण अगर किसी को पता हो कि ये बीमारी है तो दे कैन पिक इट अप अर्ली. But the most definitive test obviously is when you come to a cornea specialist and we do a scan called as topography. जो कि which can be very conclusive and see whether you have keratoconus or not. The second thing is the incidence of this disease is fairly common. That means अगर आप internationally देखेंगे data, so the data is approximately 1 in 2,000. Will have keratoconus. This part of the world जहाँ पर हम हैं because of the humidity and the heat. The Middle Eastern belt, India, Philippines, ये जो बेल्ट है अफ्रीका, इस पूरे बेल्ट में keratoconus का इंसिडेंस ज्यादा है. So we have reports of as high as 1 in 500. That means अगर मान लो एक किसी स्कूल में 3,000 बच्चे होंगे तो उनमें से 3-4 कोई डिजीज हो सकती है. Can be that common.
So guys, don't go anywhere. Please stick around. This is 89.1 Radio 4 FM, जहाँ पर आज हमारे साथ है Dr. Gaurav Prakash, who's a cornea, refractive and cataract surgeon from Ophthalmology Department, NMC Specialty Hospital, Abu Dhabi. So what is the treatment? And like you said कि ये बच्चों में भी हो सकती है, बड़ों में भी हो सकती है. तो क्या treatments different होते हैं? What is the treatment for this firstly?
See, the initial part, first of all, once we diagnose somebody has keratoconus, we can initially manage the vision, which is the more. इसमें दो चीजें हैं, जो विजन पेशेंट का है वो कैसे मैनेज करना है और जो बीमारी है उसको कैसे मैनेज करना है. विजन इसमें खराब होता जाता है ना. तो पहला पार्ट ये है कि आप इनिशियली विजन को ग्लासेस से या कॉन्टैक्ट लेंसेज दे करके वी कैन मैनेज इनिशियली. पर जो बीमारी है उसको रोकने के लिए, केराटोकोनस को रोकने के लिए देयर इज अ ट्रीटमेंट व्हिच इज कॉल्ड एज कॉर्नियल क्रॉस लिंकिंग. इससे दिस हैज बीन अ फेयरली रीसेंट एडवांसमेंट लास्ट 13-14 ईयर्स सिंस 2003. उससे पहले करीबन 15-20 साल पहले जब किसी को केराटोकोनस डायग्नोस होता था, उसके बाद देयर वाज नो ट्रीटमेंट फॉर दैट. वी हैड टू वेट टिल द कॉर्निया बिकम सो ectatic या so weak. You have to change the cornea. You have to do a corneal transplant. Now the incidence of corneal transplant in keratoconus is fairly high before the advent of cross-linking. So it used to be fairly gloomy scenario. कि आपको यंग बंदा है, कोई अपना करियर स्टार्ट करने जा रहा है, 16-17 years old child is going for engineering or medicine or some other job and he is diagnosed with keratoconus. तो उसको बेचारे को ये पता होता था कि 10 साल 15 साल बाद I might need a treatment in which the cornea changed. This situation has drastically changed from the last 12-15 years by the advent of this treatment called as cross-linking. इसमें हम क्या करते हैं, we use riboflavin which is a vitamin and we use UV light to strengthen the cornea. तो जो कॉर्निया का नॉर्मल स्ट्रेंथ होता है उसको हम 2-3 गुना बढ़ा देते हैं इससे. और जो बल्जिंग का प्रोसेस होता है, वीकनिंग का प्रोसेस है, ये रुक जाता है. This is the treatment line of keratoconus which we are doing nowadays and which is fairly effective. In fact, the amount of patients जिनका हम पहले ट्रांसप्लांट करते थे, सबसे बड़ा इंडिकेशन उसमें keratoconus होता था. इस पर्टिकुलर पार्ट में अभी it is the 6th or 7th largest indication. Other things have become more common. Keratoconus will be diagnosed early and treated very early. The reason why we stress on early diagnosis because there's a good treatment available. कई बीमारियों में आपका long term treatment available नहीं होते हैं, उसमें हम early diagnosis पर stress नहीं करते. Keratoconus definitely is a situation which actually a lot of people don't know about keratoconus. They keep on thinking कि number change हो रहा है तो natural होगा, number change होना कोई बड़ी चीज नहीं. And they keep on going to get new pair of glasses and keep on increasing the thing till it becomes quite advanced.
Okay.
So my recommendation for those people is if you have any of the symptoms you have discussed and if you have any of the signs, then you can go to your optometrist or somebody who's close by to you. Okay. And then you can come to a cornea specialist and get a screening done if the referring physician feels the keratoconus ho sakta hai. Awareness is very, very important in this particular disorder to pick up early and treat early.
Okay. So guys, don't go anywhere. Please stick around. This is 89.1 Radio 4 FM जहाँ पर आज हमारे साथ है Dr. Gaurav Prakash, who's a cornea, refractive and cataract surgeon from Ophthalmology Department, NMC Specialty Hospital, Abu Dhabi. So, Doctor, please tell us what is the role of NMC team in keratoconus?
We have a specialized keratoconus clinic with us. What we do is basically me and the team we have over here we use cutting edge new technology for cross-linking and keratoconus management. हम लोग they are doing collaborating with lot of international groups in which we do research in keratoconus, early diagnosis and treatment. As I told you, इस बीमारी का treatment और बहुत जल्दी करने के लिए जरूरी है कि इसको टाइम से डायग्नोस किया जाए.
Okay.
So what we are in fact I'm happy to say that a lot of collaborative work has given us new insights into this disease which we collaborate with other centers in the world and we sit and find out कि किस तरह से हम patients को जल्दी pick up कर सकते हैं, diagnose कर सकते हैं ताकि उनको जल्दी टाइम से treat कर सके. Community based service के हिसाब से we do screening camps, we do awareness talks in universities. We generally tell patients of keratoconus to be patient evangelists. That means, for example, somebody who has keratoconus and has undergone treatment.
Okay.
We ask them to spread the word because best awareness इसमें तभी होती है जब community में लोग एक दूसरे को इस बीमारी के बारे में जाने और उसका ट्रीट करना शुरू कर रहे हैं. The second factor is because there can be around 10 to 20% patient जिसमें keratoconus genetic होता है. उसमें अगर किसी पेरेंट्स को अगर keratoconus रह चुका है या किसी को आज keratoconus है तो फैमिली में भी आगे keratoconus होने का चांस रहता है.
Okay.
इस कारण से ये बहुत जरूरी है कि कम्युनिटी लेवल पे अवेयरनेस हो इस बीमारी की. For that very incentive, for that very reason, internationally it has been recognized all around the world that we will mark 10th November as the World Keratoconus Day. That's the first World Keratoconus Day starting this year. So उसमें ऐसा होता है कि sometimes people would have not even heard about the disease. जैसे कि हम बात कर रहे हैं आज लोगों नाम पहली बार सुना होगा keratoconus की बीमारी होती है. क्योंकि इसके लिए there is unfortunately no Hindi translation for the word. Conical cornea आप बोल सकते हैं इसको, आप ऐसे बोल सकते हैं. इस कारण से कुछ बीमारियों का जिसका हिंदी ट्रांसलेशन में होता है it does not spread out, the word does not spread out.
Okay.
नहीं, इस वजह से बहुत जरूरी है कि कम्युनिटी में जिन लोगों को इसके बारे में पता है या जिनसे हम कभी मिलते हैं, जिनको मालूम होता है, जिनकी फीलिंग होती है, और लोगों को बताएं. And that is what has been our strength so far, that even if let's say you were trained and you didn't have keratoconus, very good, but at least then others might have it and we can pick it them early.
Okay, so last question I have for you is how can we know more or get screened for the disease?
First of all, obviously keratoconus पे बहुत सारे support groups हैं, health in information group, and we have small counseling groups in which we can talk to patients who have keratoconus. The best way, however, to know more about the disease is that you can read you can read more about on the internet. You can attend one of our sessions. We discuss about the disease more further.
Okay. And
the best conclusive evidence is to get a screening. अगर जो symptoms मैंने बताए जैसे कि आपको मान लो अगर eye irritation है, eye rubbing बहुत ज्यादा है, difficulty होती है right rubbing में, number आपका बहुत frequently change हो रहा है and it's not getting stabilized. Even let's say somebody is 20-21 and his number still changing. That needs to be looked at into why the number is being changed. ये सारे symptoms होते हैं तो they can come to a cornea specialist for screening. We can do a simple test called topography which takes around 20 seconds in fact. And we can pick in that with a relative 99% surety that at that point of time do you have keratoconus or not.
Okay. So thank you, doctor. It was great information you shared with us. Thank you so much. So guys, that was Dr. Gaurav Prakash, who's a cornea, refractive and cataract surgeon from NMC Specialty Hospital, Abu Dhabi. Thank you, doctor. It was lovely having you. Thank you. Bye.
Thank you.